Hello, doctors. It is a wonderful, little bit of a rainy Thursday, and I want to welcome you to our next Docpreneur CMT video broadcast. We've had to all kind of change some of the ways that we're doing things and connecting with doctors and you've had to change some of the ways that you're connecting with your patients. And in the next episode of our Docpreneur broadcast at Concierge Medicine Today, I want to challenge you with a question to think about, and that is, what are some of the things that you're going to carry with you into the next season of transition? So, the world is going to change a little bit. Not everything's going to change completely, as we all know, but some things are going to remain the same as they are right now. And what are you going to be carrying with you? Maybe it's the application and utilization of telehealth apps and doing things more remotely with your patients. Maybe it's still going to be, you'll still have a lot of in-person visits, but maybe the safety precautions will look a little bit different. So our world is changing around us, and we don't know what the next phase looks like, and we're excited to explore that together. So email us at editor@conciergemedicinetoday.com. Let us know what's going to be changing in your practice, and what are you going to be carrying with you that's going to that you're trying during this season that has worked well or hasn't worked well, that you're going to do and maybe discontinue doing here in the next several months and weeks ahead. So enjoy the next Docpreneur Leadership broadcast by Concierge Medicine Today. And thank you, doctors, for all that you're doing. Whether you're going through a hurricane right now or through a time in your medical practice and career where it's just a little bit quiet, we want to recognize all of you and all of the hard work that each and every one of you are doing, and your teams too. Can't forget about your teams and your families. You have sacrificed so much for everyone, and we just want to say thank you. And we know that you mean so much to us in this time of transition for all of us. So we'll see you very soon, hopefully at the Concierge Medicine Forum, but enjoy the next Docpreneur Leadership broadcast. Thanks. Bye.
So our guest today on the Docpreneur Leadership broadcast and podcast as well is HIREN DOSHI. He's the CEO and founder of Paragon Private Health, and also now leading the way with Paragon Telehealth, two separate organizations and companies. So HIREN, thank you for being with us. Looks like you're there in New York, and we're down here in Atlanta.
Well, good afternoon, and thank you for having me.
Absolutely. So before we jump into some of the meat and potatoes of why we're talking about telehealth and digital health and doctors and so on, and let's talk a little bit about how you got involved in healthcare. What drew your interest into the big grasslands of healthcare?
So strangely, I've been involved in healthcare right out of my college. So I've only been involved in healthcare in some shape or form. The first thing that I did out of college was I was involved in a medical transcription business, a startup back in 1999, 2000. Thereafter, I was involved in healthcare, but in a different side, in the dietary supplement side, where we made active ingredients, clinically validated raw materials for supplement companies. And then that led into back in mainstream healthcare, which is with concierge medicine. So my entire career has only been involving healthcare. And it is something which I have a liking for and a passion for. So seems to find itself in my life.
Absolutely. And what led you down the path to working in concierge care and concierge medicine and eventually founding Paragon Private Health?
So actually, my getting involved in the concierge medicine industry was truly a random occurrence or a random event. I was a disgruntled patient. My wife was sick and she had to suffer through the healthcare system. This was back in 2011, where for a small thing, she got kicked around from one doctor to another. And after a week-long saga, it took a a doctor just asking her two questions, just listening to her, understanding what medication she had taken, what she had done thereafter. And it helped her overcome the issue. And we were led all the way to the ER for that. When we learned that, or when we corrected ourselves and my wife was taken care of, I was a bit angry that what happened to that family doctor, what happened to that physician who just took care of you till you were well. And then as I researched, on one hand I was angry, and then I was looking for right care for myself. But as I researched the subject more and more, what I learned was that the physicians themselves were quite disappointed with the system. In fact, a majority of them never got into it for the money, got into it for pure love of patient care, especially true for primary care physicians. And they were just struggling and suffering themselves, just as we suffered as patients. So one thing led to another. And I discovered this whole concierge medicine industry, that's the industry which had truly preserved that patient care at the center of it, old-fashioned family medicine at the center of it. And I started attending concierge medicine conferences just out of sheer interest. And before I realized, I had started a company and invested in one. So that's how I got sucked into it.
Well, and I think there's a lot of patients who have a lot of gratitude for that, and certainly a lot of doctors who have found a career lifeline by connecting with you and your organization, and certainly just learning about this space has been, I think, helpful for a lot of doctors out there and a lot of patients. So let's talk a little bit about what the pulse is right now of some of the doctors out there that you're working with and that you see and connect with on a daily basis, because we're starting to see the isolation is setting in among patients. We've even heard from patients and that their doctor has gone radio silent on them, and there has, that's kind of sad to hear, and we need more connection during this time. I've actually found that there's three things that a lot of people and patients are wanting. They have diabetes or they're in the critically ill, space is, we want connection. We want to feel a sense of belonging, and we want somebody to help manage our fear and expectations. And even if it's just a simple routine check-in calls, hey, how you doing? That call's not necessarily going to last 45 minutes every single time. It might only last 7 minutes. So what's some of the pulse, and what are you hearing out there from doctors about how good and some of the good things and some of the bad things?
Sure. So I'll say this entire pandemic has been a disruption for everyone. And like you rightly pointed out, for healthcare in particular, we don't talk about it. We talk about how the airline industry is suffered. But if you go talk to private practice physicians, you'll hear them talk of loss in revenues and loss in activity more than revenue, of anywhere from 50% to 90%, depending on how quickly they were able to adapt and make changes to the modality of how they delivered care. So it is a complaint across the industry. Having said that, what we experienced as Paragon Private Health was completely different. So we actually found ourselves ahead of the curve. We had been tracking coronavirus right from the first week of February. We were staying on top of all the announcements that were coming out from CDC. Before they started making mainstream media, we had been staying on top of it, both for our patients and for our physicians. Mm-hmm. So one of the things we did was we were communicating with our physicians and patients what CDC was saying, what WHO was saying, and we kept all the mainstream news media outlet out, because we didn't want any sensationalizing of what was going on. We wanted to make sure we cover facts, and hence what happened was our physicians and our patients' preparedness on coronavirus was far greater. Mm-hmm. Because it was far greater, actions that had to be taken for them to provide continued care was also far greater. So the way I viewed what we should be doing at such time was, hey, how do we keep our patients safe? And then how do we beat the statistics? If we give good information, good knowledge, and if less of our patients contract coronavirus and let's get hospitalized, then, we've beaten the statistics right there. And then for our doctors, it was more about if you can enable them to provide that connect with the patients, if you can provide them the right information and the right actions to take. So what we found is that exactly opposite of what happened with general healthcare. Paragon and our physicians were extremely busy in February and March, extremely busy, because we were continuously communicating with our patients. So on one hand, we were communicating with our physicians because we wanted to make sure we bring in good expert advice for our physicians, because even the physicians didn't know what to do. Most of them didn't know, what does this mean? What is the right information? What they should be doing? What their staff should be doing? Should they bring patients in? Should they not bring patients in? What should they be telling their patients? So what we did was we took the lead in educating our physicians, and then we took the lead in helping our physicians educate the patients. So our entire experience in February and March, and I would say mostly March, was we were extremely busy, but we didn't feel that loss of connection with patients.
Wow. And what are the types of things that you think are important for physicians to start educating their patients about now? We see that we were talking offline a little bit about, building our immune system and our immune tolerance, and we're not getting exposed right now as patients and individuals, and physicians themselves are being exposed to a lot, but as patients, we're not being exposed to the general germs and bugs out there that we normally do. So are we looking at coming back and having a bit of a surge in just overall sickness besides COVID-19 in the summertime? We'll, because our immune systems are not are a little bit compromised, or what are some of the discussions that physicians are having themselves to say, well, yeah, we need to get ahead of this because this is what's going to happen in the next month or two?
So I hope not. I hope not what you said. But what our physicians are continuously talking about even now is again, media continues to be abuzz with so many different viewpoints and thought processes and so many different school of thoughts emerging. So one of the things we have tried to stick to is not follow anything until CDC adopts it. If and when CDC adopts it and starts talking about it, then our goal is to be the one implementing it next day. So we don't even want to wait 1 week before it trickles down and makes news. Our goal is, how do we pick it up next day, disseminate it? So our physicians get alerts on things which CDC gives advice on, including webinars by them, literally as and when they happen. So, when the trainers are getting trained, our physicians are getting trained. Yeah. And at the same time, our patients get information literally every Sunday. So come Sunday, they have the most recent CDC updates. And we make sure we disseminate that. And to a level where, when we send these alerts to our patients, we get anywhere from 40 to 70% open rates.
Wow.
So unbelievable open rates. So our patients are listening.
Yes.
And because they listen, we take this responsibility seriously.
Yeah, and for those people listening, if you've ever sent out an email campaign, that's unheard of. I mean, usually you're looking at 12 to 17% open rates if it's a really good email. And so that is incredible. And it means that, patients are longing for good information. They're longing to hear from their doctor. And certainly concierge medicine physicians have that connection, that relational connection with their doctor. And it's a tough job too. I mean, there's no bones about that, because you're managing expectations. You're almost like any good realtor, when you're buying a house, you kind of we'll put the crystal ball on and out and on the table, and let's see what's the buyer going to do? What's the seller going to do? What's this COVID-19 thing going to do, Doc? I need to know. So our guest today is HIREN DOSHI, the CEO and founder of Paragon Private Health. And you can learn more about Paragon Private Health and HIREN and connect with them. But also we're going to talk a little bit about Paragon Telehealth, that new organization. But before we jump into that, there was some news that kind of broke last week with relation to Paragon. And tell us a little bit about that and how it's kind of going to mold for you on a day-to-day. What changes for you on a day-to-day basis? What doctors can expect on a moving forward that are interested in concierge medicine and this type of business model in the future.
Sure. So Paragon Private Health and Signature MD, two organizations came together and merged as of 2 weeks ago now. And the whole idea was founded in the fact that we, Paragon Private Health has been growing nicely over the past several years. We were in fact the only concierge company to be recognized by Inc. magazine to be among the 5,000 fastest growing companies in the country in 2017 and 18. And when you've grown, you have to always pause and think that, hey, what's gotten me here? Is that the best thing for me, or is there a different path which will be better for me for the next stage of our evolution? And as we considered various options, what we learned or what we felt was that a bigger network would be a much better thing for Paragon. We had done a fantastic job in developing a good product with a good array of services. We as a company had a tremendous focus on patient experience, on how do you deliver that experience which want patients to keep coming back? How do you keep weaving innovation and technology? And having built such a good product, our network of physicians was at 40, and our goal was, hey, if we were able to take this to more physicians, they would all benefit and enjoy more. So we found that Signature MD shared similar values in terms of bringing best in class to their physicians and patients. And what we also found was our strengths and their strengths were quite synergistic. They were able to build a larger network of physicians. So they clearly know how to keep expanding the physician base a lot faster, and we knew how to deliver that enhanced care. So that's how the merger came about. And Matt Jacobson, who's the founder and CEO of Signature MD, he is a thought leader in concierge medicine. He's built this company from 0 physicians all the way to 130, and now he's going to be the CEO of this joint entity, which will be a combination of 160 physicians.
Great.
So that's what's come about.
Well, congratulations. That is a big undertaking, and certainly looking forward to seeing some and hearing about and learning more about that. But what can physicians who are curious and who are, just dipping their toe in the water of, because we're going to start to see a lot more physicians, I think, calling organizations like yourself that are saying, it's been a tough year, and I need to learn more about this thing and these types of business models. I don't know if this is for me. What is their first step? What's your first piece of advice or litmus test for, and do you think, we're starting to see more nurse practitioners, physician assistants, RNs lean into these concepts and subscription-based medicine, simply because patients today don't understand the difference between a medical degree or a DO or an FNP. They just don't, and they want their problems taken care of, and that does a disservice to some patients. But what do you foresee? I'll let you jump on that grenade of questions there.
Sure. There were multiple questions there. I'll take the first one, which is what in the current environment, and if we strictly view of what happened from a physician's perspective, and what's happened in the current environment from a physician's perspective has been most physicians, whether primary care or specialty care, have seen a massive decline in revenue. Because they saw a decline in the ability to provide patient care. You hear numbers anywhere from 50% on the better side to as much as 90%, 95%, or even 100%, where some physicians just said, you know what, I'm not going to take any risk and I'm not going to see any patients. And they saw complete decline in revenue. At such times, our concierge physicians, so the number of conversations I had with our physicians where they were grateful and thankful that they switched to concierge medicine was more in the past month and a half than it's been in my entire time doing this. And the reason is our concierge physicians saw a sustainable stream of revenue through all of this. A lot of our physicians for whom concierge revenue was a majority of their revenue saw their revenue not impacted at all. And when they noticed that, here they had a stable stream of revenue, they could keep the lights on, they could keep the staff, and then they could continue to keep providing proactive care to patients. they felt that this is probably the best. They may have made this decision for a different set of reasons, but it delivered in spades at such time.
Oh yeah. And what does, a first year look like? I mean, not revenue wise, but I think from a career satisfaction, lifestyle satisfaction, we've heard from many physicians over the years in this space of this changed my life. It saved my marriage. It does a number of things. It helped a lot of people in my community. And really that's what it is. It's not necessarily, doing this that everybody's going to love it. Everybody's going to join it. The whole city's going to find out about it. You have a 5, maybe 3 mile radius around you where most of those patients live and work. And they're looking for connection. They're looking for belonging. They're looking for answers to their questions. And they could be all ages. And there's usually a set of a demographic age group that usually joins these types of practices, but they're of all ages as well in different parts of the country and now part of the world. But what is patient attrition? Is that something that physicians, just as a concierge medicine 101, if physicians are leaning into this for the first time and they're learning about Paragon and what you guys are doing and about this concept in this space, what does that first year look like? Are they just satisfied? Are they happier? Are they working as many hours? I've heard doctors also say, I work as many hours as I did before. I'm just happier.
So your last word describes it the best. Every single physician who makes this transition to concierge medicine is happier. A majority of them are apprehensive or are unsure or they are anxious on what will it all mean. And even after talking to their friends who say they are happier, talking to us when we tell them you'll be happier, they have a little disbelief because it sounds too good to be true. And then when this transition is done, they are happier. And the reason they are happier is concierge medicine is all about patient care. That's really what it boils down to. It is all about being able to provide that patient care which you consider that's in the best interest of the patient, that you consider in your professional experience what you would want to deliver, should want to deliver. And this is the time you get to deliver that. And that feeling of satisfaction you get is second to none. So the number one reason physicians have been going concierge has been that. It's actually, in my experience, monetary reasons have maybe been number 2 or number 3. And the physicians for whom patient care is number 1 are the ones who anyways do better at concierge medicine. Money is a side effect of concierge medicine, or it's a side result of concierge medicine. It's never the driver why anyone should ever do it.
Yeah.
It's not the recipe for success.
Well, before we jump off the lily pad of concierge medicine, membership medicine, subscription-based healthcare delivery models 101, what are your thoughts on there's been a lot of different models, and this kind of dovetails into our telehealth discussion because there's subscription-based models, inside of the telehealth atmosphere. You can log on and find an app and talk to a nurse 3 times a month for a certain price. That has come a long way. We're also starting to see where there's a kind of a cousin or another model, direct primary care. We're starting to see virtual private primary care, just delivered by doctors and nurses and PAs over video, more and more. And so what are your thoughts on those models, and I'll just let you tackle that one. It's a big animal.
Sure. So there's, like you rightly said, healthcare has never been about a single form of delivery across the entire country. There's always been these different types of delivery forms which have evolved. And interestingly, they find a way to coexist because we are dealing with a diverse patient pool. We are dealing with patient pool of different socioeconomic backgrounds. We are dealing with patient pool of different age brackets. We are dealing with patients who have different technical capabilities and comfort. We are also dealing with patients who have a different medical need, and some who need physicians and care a lot more than others do. And with that diversity, all these models have a place. If you just talk the two extremes of concierge medicine, which is very, very focused on high touch and relationship. And on the other hand, you have virtual care where you could not be talking to the same nurse ever again. And both succeed. Why do both succeed? Because the patient who wants that connect is a different kind of patient versus the patient who just wants episodic care. And it doesn't matter who it is, as long as it's someone who's medically qualified or professionally qualified to provide care. So I don't think it's going to be one versus the other. It's going to be, all of them are going to get adopted, because all of these are change from status quo. Mm-hmm. And the status quo used to be, hey, walk into a doctor's office, see a doctor, and get care. And Absolutely. These different forms are adjusting and adapting to an emerging patient need.
Well, and our guest today is HIREN DOSHI. He's the CEO and founder of Paragon Private Health, and we're about to talk about Paragon Telehealth, the new organization that you've already launched, you've already taken control of there, and started and founded, and that's exciting. And one of the things that we've also started to see just in the recent weeks, and we've seen this for years, and we've been talking about it here at CMT and DPC Journal for years too, is retail healthcare. And we've really seen retail healthcare move into our communities over the last several years, and it has been a part of our kind of, I guess, weekly news updates and press briefings because of the COVID-19 testing that's occurring at, in parking lots and inside of pharmacies. And so, those types of things, again, they're episodic. You can go in, I've been to them myself as well, and they have their pluses, I mean, for certain. And just part of the research of what we have to do, you have to get sick and you have to go to some of these places too and see what the competition is. And I wouldn't necessarily even say that they're competition, but I would say that they're competition for telehealth programs. They're probably competition for your mass market variant direct primary care programs. And I would say they're also probably competition for your traditional plan reimbursed primary care offices that operate, as we all know and go to those offices. So where do you see telehealth and Paragon Private Health? What problem is it solving, and how is it going to be something that we're all going to start to investigate in the years and weeks and months and days ahead?
Sure. So I'll actually begin with your point about retail clinics, and if we even specifically talk Walmart, they have a test site in Atlanta after they opened the first one in Texas, mm-hmm. and I haven't been to one, but the presentation by their head of healthcare at health conference last year, I was blown away. In fact, I can take it back one health conference the year prior where they spoke about their ambitions, and then last year they actually demoed it. Yep. I was quite impressed. They are going to be and excuse me for a second.
Sure.
I'm getting kicked out here.
No problem.
But I'm fine. Yeah. So they are going to be a very important innovation or market shaper. They are going to change the way healthcare is delivered. Everyone who's in private practice has to rethink how they deliver if they want to continue to stay relevant. If they want to continue to, because what Walmart and others are doing is they are completely changing the modality of how care can be efficiently delivered in a very clean, experiential way, which is second to none. So in light of all of this, anyone who has not been thinking what they should be doing should be thinking and should be pausing and thinking what they should be doing. So anyone who's in healthcare has to take stock of that. Mm-hmm. Now, coming to telehealth. So telehealth is I don't view that as a competitor. I view telehealth more as a modality for anyone who's providing care, to provide care. So instead of it being, just like if we go back to the late 90s or early 2000, where we used to only talk of brick and mortar and .com, and we said, hey, .com's going to come in and it's going to take over the world, and then we realized, well, you know what, they both coexist. While Amazon did become a big way in which how commerce is done, it didn't shut down brick and mortar altogether either, right? So it's essentially .com and brick and mortar both serve a different population, or both serve a different need at different points of time. You know, I will walk into a Barnes and Noble and buy a book, but I will also order a book from Amazon, and I will go to Barnes and Noble for a different reason, and I will order from Amazon for a different reason.
Absolutely.
So telehealth is going to be akin to that analogy, in my opinion, where we will all use or get care using both these methodologies. So every healthcare organization has to think, because of coronavirus, this entire adoption is going to get faster, where telehealth was not getting adopted. And of course, one of the big drivers was regulation, reimbursement, and so on and so forth. And I'll get to that in a second. But until now, nobody was delivering or getting care using both these modalities. Coronavirus has taught everybody how to get virtual care. And because it has taught everyone to get virtual care, every healthcare organization has to have a setup where they can give in-person care, and then they can give online care. So every concierge physician has to deliver both kinds of care. Every DPC physician has to give both kinds of care. Even Walmart will have to figure out how to give physical care and telecare. Even Kaiser knows that they need to do both, but every single health system and hospital system will have to make sure that they can deliver both kinds of care. So really, they are going to become just two ways of how we operate. Now, coming to the point of regulation, where regulation was probably the single biggest hurdle. But if you heard Seema Verma, the head of HHS, talk just recently, and I'll quote her. She said, "Genie's out of the bottle. So telemedicine is here to stay."
Yeah.
You know, it's just the HHS will have to, while they have only provided temporary guidelines, but they are going to convert those temporary guidelines into something more concrete, so that this form of care just becomes a part of care. I mean, she's not said that, but you know, that's a hint right there.
Yeah. Well, and we've talked with some health systems just this week, and they're certainly looking in to, you know, how they're going to continue and how they are going to equip their physician-owned practices in their certain communities to, you know, to adopt these programs. And it seems like when we think about telehealth, we think about, this is a software technology application. There's a lot of options out there. And I don't know necessarily where to start, what I should be reading, what I should be considering. It's kind of like jumping into the pool and not knowing how to swim. And so what advice do you have for physicians, whether they're in the private medicine or concierge medicine space? But I think it's even larger than that, this conversation. It's any physician right now feels like they're going to be jumping into the telehealth pool. And there was about a week where in March, towards the end of March, where that adoption took place within about a week or two. And next thing you know, offices are quiet except for the COVID-19 testing patients and those symptoms patients. But then it was kind of, we're starting to see more telehealth. And now weeks later, we're starting to see physicians say, please come in. Like if you have, you know, heart attack symptoms, we need to see you. Don't rely on, you know, on just don't rely on just a phone call. There's things we've got to do in person. And we realize that there's a whole other world besides COVID-19 that's still happening in our healthcare space that you are being impacted by. And so, you know, that in a way is saying, don't just rely on phone calling me and FaceTiming me and videoing me. So how do doctors overcome those challenges, but where should they start learning about these? And Paragon Telehealth is certainly a good way to go. But what problem is it solving, and how do physicians connect with it, and what's the patient connection with it too? Because we've also started to see that, you know, physicians will test things on themselves to make sure that the reporting is good, to make sure that the connection is good, to make sure that the testing is good before they even present it to their patients.
Sure. Well, physicians have always been a cleverer group. all that education is something that gives them a thought process, which is probably amongst the most advanced of all human beings. And they think harder, they think deeper, they make very well thought out decisions. Now, when it comes to telehealth, uh, there's lots of factors to consider, but I'll try to boil it down to really two or three, which probably should be at the center today. And as time goes, those two or three will change. And the reason I say that is telehealth is also evolving. What's available today is different than all the products which are under development today. So what's going to be available a year from today is going to be different.
Yeah.
So, when you have to make a decision at a week's notice, imagine picking an EMR at a week's notice. Are you end up picking the best EMR? Probably not. And does it mean you'll probably end up switching your EMR to one that is better suited to your needs? I think it's going to be similar. So and in fact, if I were to use that same analogy, that at its peak there were over 500 EMRs, and now if you actually do an analysis of how many EMRs are capped or cover 90% plus of the market, it's less than 10. So
Yes.
so it is going to go through that wave of consolidation and sifting of options on what really ends up surviving, right?
Mhm.
So for doctors, the single most important thing you want to look for in a solution today is a solution that is easy. You don't want a solution which is clunky and difficult to implement for yourself and for your patients.
Mhm.
So that's the first thing you want to look for. The second thing you want to look for is what is HIPAA compliant? Because if you pick a solution that is not HIPAA compliant, whatever you're doing is patchwork. It's going to last you maybe as long as HHS keeps the HIPAA requirement waived, and they are going to turn the tap on that one day. It's a guaranteed event.
Mhm.
So you are going to be stuck with a solution which is not HIPAA compliant. So if you picked up Skype or FaceTime as a telemedicine solution, then it has a limited shelf life.
Yeah.
So that's the second most important action item.
And before we jump onto that,
Sure.
are most of those right now, for those, because we have a lot of young physicians listening as well that haven't dove into this too greatly, are a lot of those right now already created to be HIPAA compliant?
No. So a telemedicine solution doesn't equal to HIPAA compliant automatically. HIPAA compliant is very specific actions taken as far as the technology is concerned to encrypt the messaging, encrypt the video visits, so that you don't have occurrences like what happened with Zoom, where someone else cannot join your encounter. You just need that security measures where you know that someone is not able to read your messages or from another side of the planet. So that's really what is not always a part of every telemedicine solution. I haven't done an analysis, but I would hazard a guess. A good chunk of them have not seriously thought through their HIPAA strategies, because you can't develop a technology solution overnight and have it HIPAA compliant.
Yeah.
It takes years of or months of work at the very least.
Yeah. Well, I'll let you continue on your second point.
Sure.
Prior.
So yeah, the first was easy. Second is HIPAA compliant, and the third one is actually a more general point, which is you want to look at solutions on what is the vision that the company has about the future, as to what is their product roadmap. Are they making the investments, and are they committed to enhancing the product?
Yeah.
Because you are going to need a whole set of things. You're going to need EMR integration. You're going to need integration with other devices. You're going to need simplification. You're going to need interoperability. You're going to need something which can fit your workflows. You're going to need something which can get patient consent. You're going to need something which can get prior authorization. You're going to need collecting insurance data ahead of time. So all these things are going to be things which are going to be in future avatars of product. Question is, you want to be working with a company who's proactively thinking about those things, and not with a company who says, hey, here's a simple product. It does what it does well today. and it will continue to do this all the time.
And we've seen many of those small companies, have amazing tech. And, their goal is pretty easy. If you visit their website or talk with a representative, talk with the CEO, that their goal is to get acquired or to get more capital, to just move on to the next phase. But their tech might be great, but they might not be a long-term solution. And our guest today is HIREN DOSHI. He's the CEO and founder of Paragon Private Health, and now the CEO and founder of Paragon Telehealth. So tell us a little bit about Paragon Telehealth and what it looks like to connect with Paragon Telehealth for the first time as a physician and then as a patient.
Sure. So first and foremost, we built this product, or we started building this product about a year and a half ago. And we just built it with a vision of giving enhanced care to our concierge patients. So our vision was very simple. Concierge patients are patients who are paying a premium price to get premium care. Yeah. And our goal was, how do we deliver them telemedicine as an option of care? How do we allow or enable them to do HIPAA compliant texting? How do we do things which enhance the experience for them? So the way we went about developing this app is we actually interviewed our physicians. So what we did was we actually looked at EMRs out there, and the biggest complaint we hear of EMRs is most EMRs are designed with billing in mind. They were always designed with how do you enable easy billing. Mm-hmm. So if you talk to a physician, you will never hear a physician praise an EMR. You hear a physician complain about an EMR or complain a lot about an EMR.
Yeah.
Right? So when we saw that, what we learned was that all EMRs were built by guys who were very intelligent product technocrats. They were fantastic at management of healthcare, mm-hmm. but they never took a physician's viewpoint of what is it that works for a physician. Mm. So what we did was we interviewed our physicians and asked them, what matters to you? And we made a list of 40 different things, and then we rated them. And after we did this interview, what we learned was, while there was feedback across the board, we found the 3 or 4 things that were common across most physicians. And we built a product with those 3 or 4 features. So one of them was they wanted something which would be easy for them and easy for a patient, where if a patient logs on, they felt that it should look and feel more like a app that a good consumer product company's app would be like, a more Uber-esque experience and a less medical experience. Mm-hmm. The second thing that they cared about was, as silly and simple as it sounds, is scheduling appointments. Hey, we need simplicity in scheduling appointments.
Yeah.
The third thing that physicians told us about is, again, a workflow issue. But what our physicians told us is very often they have an encounter with a patient, and the action item is, hey, here's a PA or an MA that they want to task. Hey, can you write them a prescription for this medication? Or can you write up an order for this lab testing? And very often they have these administrative tasks which they want to give their PA or even office staff.
Yeah.
And they find that to be such a pain point in terms of coordination. So what they said was, hey, if there is a way where in my patient encounter, if a staff member can be inserted in, so I can bring my staff up to speed and give them the actions at the same time, so there is no loss in translation, then that would be a phenomenal feature.
Oh, yeah.
And another thing which we included was one of the biggest complaints that healthcare professionals have is compliance, which is patients don't comply. So they expect the doctor to provide them the best advice, but then they don't follow the advice. So a physician says, here's medication I'm prescribing you, make sure you take it once a day. Or I'm telling you, hey, you need to cut out your smoking and alcohol. Or I'm telling you, you really need to exercise and walk 10,000 steps. Or you need to go and get this test done. So there are all these things that a doctor's offices tells the patients. And the compliance rate on what a doctor's office tells a patient is extremely low. And then that's what snowballs into bigger problems. So what we learned was, how do you include something which improves patient compliance? So essentially, when we got all this feedback, we built Paragon Telehealth app, where there's a simple interface for patients and physicians. We have an interface which is inspired by most common messaging tools, which everyone is used to. So it's intuitive, so they don't have to learn messaging style of a new app. It's what people are used to already.
Yeah, that's important.
Yeah, and as basic as it was, that's all we had to do to make it easy. Another thing we were able to do was have an appointment scheduling feature, where either it's a request for an appointment or an integration with the EMR, with whatever EMR a physician uses. It just leads the patient to that EMR and the physician schedule, so they can schedule comfortably. We built in a group chat feature where a patient can chat with a physician or a staff member. But if a physician and a patient are having an encounter, the physician can invite a staff member they want to and say, hey, Kathy, I'm seeing patient John Doe. I have told him he needs to get a prescription for this. Can you put a prescription for this at the nearest pharmacy that he suggests? So now the physician knows he closed the loop on it, and he doesn't have to worry about it. And then Kathy picks it up and takes care of that. And then we added a feature of compliance where a physician can task a patient, where if you're the patient and if the action I told you was you need to get an X-ray done, it creates a task almost like an order, where it's a task for you, and I can put a deadline that this is a one-time activity, finish it within 30 days, and it shows as an open task. So until you don't finish it, it'll keep telling me that you not completed it. So, you know, it allows me to stay on top of you till you complete that task. Now, there are other tasks which our physicians use it for also, which is, hey, take this medication thrice a day. So you can literally set 3 reminders a day, and the reminder pops up thrice a day. Take it in the morning, take it in the afternoon, take it at night. And for a patient, this serves as a continuous reminder from their physician. And for a physician, they don't have to do it again and again. They have to do it one time. And then if the patient's not doing it, they even get feedback that patient's not doing it.
Wow.
So,
well, yeah, because we're starting to use, I know for our kids in vitamins and different things that we're reminding them to do when they're doing their homework and we're in another room, you know, we're reminding Alexa, please remember to, you know, tell Matthew that he needs to take this or do that. So this is an important component of where we're going with healthcare. So if essentially for physicians listening and leaning into this, you know, I think the first question we probably have will, do I have to just be a Paragon private health doctor in order to use Paragon Telehealth, or are they two separate things? And if I'm a doctor in Arizona and I'm interested in a telehealth component, I can bolt that onto my current EMR, or is this a full-fledged EMR or EHR, or is this just a telehealth bolt-on that I can put in, plug and play, and it's ready to go wherever I am as a doctor? And I don't have to be a concierge doctor. I don't have to be I can be a specialist in Florida if I want to use something like this.
Sure. So this is a bolt-on telehealth app. It is not a full-fledged EMR, and it is designed to work for any subspecialty and any EMR and any kind of physician, a concierge physician or a non-concierge physician. So it is pretty agnostic. Now, we designed it with concierge physicians in mind. So what we are currently doing is we're currently making some modifications as now that this merger has happened. This is allowing me more time to spend on this, where I'm spending my time making adjustments to this app so that we can get any physician on this app. So we are just a few weeks away from being able to onboard any physician onto this app. We have a wait list building, and I welcome and encourage any physician who would like to be a part of this wait list to notify us so we can bring it. And yeah, let me show you what the app looks like, you know. It's a simple,
Wow, that is intuitive.
elegant looking
It
app,
just went off, yeah.
and it's actually available on the App Store, and on the App Store it's called Paragon Telehealth, and you can actually download it and you can see the screenshots, and
Okay.
and that's it. That's all there is to it. It doesn't do anything more than this. And our
Hmm.
goal is, if we add a feature, we will remove a feature that is not used. So we don't want to make it clunky.
Yeah.
We want to still keep it relevant.
Okay. Well, I'm really, I mean, what is if I'm in the App Store, is it available on Android and Apple devices?
It is.
Okay, so what's on each one, I'm presuming it's named the same. So what would they search if they type in the search bar?
Paragon Telehealth.
Paragon Telehealth, great. And it's a free app? It's something that they can play with, or is it a trial period?
So unfortunately, to log on, one has to get a user license.
Okay.
But they can still download and they can see the screens, what they look like.
Mhm.
They won't be able to use it. We'd have to, they'd have to acquire a license from us.
Okay.
And we are hoping to enable that over the next 60 days.
Okay. So mostly likely by, let's say, July 1 or July 4th is a good, benchmark. But as what is my commitment as a physician if I download the app and I want to go a little bit deeper? What is my commitment to get a user license? Is this committing me to something long term? Because we know how those long-term contracts are. It's tough to get in, easy to get into, but tough to get out of.
Sure. So there is an annual relationship, but it is not a lifetime relationship or a commitment. So there is every physician will have the ability to play with it and then decide if this is what they want, and if that's what they want, then there is an annual commitment.
And what does the onboarding process for a physician look like? Is the learning curve really steep to use something like this? And then what is what can I tell, how can I tell my patients how easy this is so that I look like the superstar among my patients?
Sure. So we have designed this from a perspective of making it easy. And because we have done that, it seems like we've gotten one thing right. Now, ease is also a function of a person's technical competence and comfort. So physicians who are technically very comfortable get on it in 10 minutes flat. And physicians who have a little challenge where they have not used smartphones before, they take an hour or two to get used to. But that's the delta.
Sorry, go ahead.
Oh, no, that's the delta from a physician's adoption perspective. And from a patient adoption perspective, generally we've seen patients adopt it literally within minutes. But you will come across that one patient who does not know how to go to the App Store. So that's the patient where struggles start. In fact, not sure if you know the statistics, but 70% of all patients have never downloaded a single app. So we are dealing with a patient population who never downloads a second app ever. So it just depends on a person's comfort.
Is that within concierge medicine, that stat, or is that within more of a broader context of physician?
That's more of a broader context. And again, I must disclaim my fact by saying this is a global number. So it may be it may be a bit biased by data from many other countries. So I don't want this number to stick out as a sore thumb. But we can safely assume that there will be a percentage of population we deal with who will never have an app on their phone. So
is this something that can also be taken, because we're starting to see more and more physicians work, and now with the pandemic, we're starting to see more, I guess, communication across country lines with healthcare information, not HIPAA stuff, but with data and evidence and is this something that other countries, physicians in London, Australia, Switzerland, places where we here at CMT have started to see more interest in these types of technologies? Is this something that is going to be adaptable to those areas, or is there going to be some, as there always is, some paperwork and difficulty to overcoming some challenges to get into those markets?
So So I'll talk of telehealth as a category. So telehealth is getting adoption globally, because the problems we faced here are problems every country faced, and hence it is seeing adoption globally. Now, some countries are not as sensitive about HIPAA. HIPAA is a very American thing. It doesn't exist in other countries. So those countries may not care for HIPAA protection. They may not care for HIPAA security. So they may not be willing to pay for things which have the cost of technology. They may just be happy with plain old Skype, and they may be happy with plain old FaceTime. So we are going to see solutions which get adopted by different countries will be based on what the consumers in that country need and what the regulations in that country require. So you're going to see a fragmented industry evolve, but telehealth is going to end up being a global industry.
Wow. And for those patients who are, for those physicians who are thinking about moving into this, give us again the search bar name for in the Android store or the iTunes Apple store.
It's called Paragon Telehealth.
Paragon Telehealth. And again, our guest today has been HIREN DOSHI, the CEO and founder of Paragon Private Health, and now the CEO and founder of Paragon Telehealth. And you can connect with each of those companies and organizations and in the links above and below. But as we come in for a landing here, we recognize we have a hard stop here coming up fairly quickly. But HIREN, this is also called the Docpreneur Leadership Podcast. And we find that in this space of healthcare, particularly concierge medicine, this is an area of healthcare where my dream, my vision has always been that I want to see other healthcare entities, other healthcare providers, other healthcare companies look at this space and say, you know what, I don't always agree with what's happening in concierge medicine, and I don't necessarily get it when I bump into the idea of it, but there's something we can learn over here. And there's something we can take from this space and we can apply it over here. It's not going to look the same, but it's something that's important in our healthcare ecosystem is concierge medicine. And if you were to hang up your spurs all like period, just say, I'm going to retire and I'm gone. I'm going to go spend some time with my family. I ask this of all of our guests, and that is, whether it be a leadership principle that you learned in working with doctors, working in healthcare. We talk a lot about concierge medicine is this marriage of the golden rule and the Hippocratic Oath. It's this beautiful unity that occurs between the patient and physician. And that's something that we're not used to anymore. We used to be used to it 50, 60, 70 years ago, but we're not used to that anymore. But if you could think on, and I know there's several stories because I've heard the answers to these over the years, is, what is that one story that helps you just say, this is why we did this. This is that patient, that doctor, this is exactly why we started this. And if we were to hang it all up today, we accomplished the vision.
Too many stories. But I know your question, so I'll answer it in a generality. The number of so Paragon was founded with a purpose, and a purpose we held very dear to our heart, which we spoke about at our organization level very regularly, was to improve health, vitality, and longevity for patients, while bringing joy to lives of physicians, staff, and all constituents we work with. And that's the purpose we kept front and center as we took decisions, big or small, as we developed our strategy or as we took a tactical decision. So any team member of our company was always driven by, hey, is this going to improve health, vitality, longevity, or is this going to bring joy to physicians? Is it doing one of them? And if it does, let's just do it. You probably heard the Ritz-Carlton story on how Ritz-Carlton trained their people, where they said, you know what, if it's bringing a guest joy, they call their customers guest. And they said, if it's bringing them joy, then you should just do it, right? So that's the philosophy we embraced within our company, and that's how we did things. And what we learned was because we did it that way, it was a purposeful business, and it was a purposeful enterprise. And what we found was our physicians and our staff we worked with also embraced that quite well. And when it's done with that mindset, what you find is a level of care and a level of joy which doesn't make work feel like work. It just feels so different. Now, in terms of the kinds of stories we've had where we've saved lives and caught things early and save people big medical trouble just because we nipped it in the bud, way too many, too many to count. And what we feel proud about is because we were able to live in a purposeful way and build an organization in a purposeful way. That itself for us and all our affiliated physicians was success and victory, or has been and continues to be.
Well, and our guest today has been HIREN DOSHI, the CEO and founder of Paragon. And as you move into your new role at Paragon Telehealth, and you can learn more about Paragon Telehealth in the app stores, both Android device and Apple devices, as well as in the links above and below. Is that same level of commitment, or what is your role with Paragon Private Health now that you're moving in as the CEO and founder of Paragon Telehealth? Will you still be a part of Paragon Private Health? What's the future, and how do they connect with that organization as well?
So Paragon Telehealth is going to be used by all Paragon physicians and Signature MD physicians at some point of time. So essentially, I'm going to be involved in the digital side of things, where as we focus on building telehealth and all the other solutions it comes up with, it will be automatically available to Paragon Private Health and Signature MD physicians and other physicians, of course. And my goal as the Paragon Telehealth is telehealth is just one piece of the puzzle. In fact, the vision is digital health. The way we view is there is lots of new innovations and developments which are about to happen in that space.
Yeah.
We consider it to be a long journey, and our goal is to play our role in contributing to all the innovation and growth that is going to happen there.
Great. Well, and our guest today has been HIREN DOSHI, the CEO and founder of Paragon Private Health, as well as now taking on a new role there at Paragon Telehealth, and that's very exciting for, I think, everyone listening. And we want to thank you for your time today. We want to thank you for what you're doing within healthcare and what you're doing for doctors. We talk a lot about around here about it's not about being the best doctor in the world anymore. It's about being the best doctor for the world and for your local community in which you live and work in. And Paragon exemplifies that as well as others. And certainly we appreciate your time today, and we appreciate your commitment to doctors and to patients and what you're doing for doctors.
Thank you, Michael.